Joined by Adrian Puren from the National Institute of Communicable Diseases, talking to us from Johannesburg. A very good morning to you. What was missed out in that speech, Adrian?
Well, not missed out. I think the President certainly raised very important points that I think we need to address. And I think that some of that will certainly come through over the next few weeks. We've seen the rapid rise of cases in the Western Cape. And we've certainly identified what we call so-called hotspots, which we need to focus on. I've raised in this particular program as well, we don't really know the strategy in other provinces with regard to whether or not they're targeting hotspots or whether they're continuing to do community-based testing. We certainly see an increase in the number of tests being done. However, in terms of identifying and managing these hotspots, I think the strategy will have to change, or some thought given to how to deal with trying to look at community spread, but also trying to really look and focus on hotspots. Because really now it's really becomes critical to have data in more or less real time for us to make certain decisions around tracing and isolating and quarantining individuals that do certainly become infected.
There are many schools of thought when it comes to testing. Are we doing testing the right way? Is it revealing what we need to know?
I think it reveals a certain amount of information. There's still a lag, because what you're looking at is the test accumulated, in other words, but it doesn't tell you when those tests were actually taken. So we really need an epi curve to really get a good sense of how the epidemic is certainly taking shape. So certainly there's accumulation of cases, but I think what needs to be done is really focusing and targeting our testing.
And
so we certainly have ramped up
STIs and the asymptomatic transmissions that you are concerned about.
Yes, so that's also very key. I think the WHO has said that you need multiple dashboards. You just don't need a COVID-19 dashboard. You need the other dashboards around STI, HIV testing, TB testing. And as you know, that has been the nub of many discussions around the fact that, in fact, there have been declines in testing around TB. And I'm sure in the case of HIV viral load testing, there's certainly some evidence of a certain degree of decline. And that has implications for people in terms of being on treatment, as well as people who are not coming forward to have themselves tested. We've certainly seen this for respiratory viruses as well. There's actually certainly been a decline in the number of consultations around that, especially as we approach the flu season. So I'm hoping that this level 3 means we have to be more responsible around our social distancing or physical distancing, but also actually ensuring that we're actually making use of our healthcare systems, and that the healthcare systems are ready for us to actually approach them.
Adrian, I'm hearing that in some instances, some hospitals are not putting down a death as a COVID-related death if there is underlying problems like HIV and TB. Surely that'll be painting the incorrect picture.
Yes, it's a debate that happens not just in this country, but many other countries. So it's very critical that we do have that information, but the way in which we can try and access or understand that is to look at the MRC are doing the excess morbidity and mortality data, is really just to see whether or not we're seeing an uptick in the numbers there that will probably be ascribed to COVID rather than just other underlying conditions such as TB or HIV. But we do know that these conditions certainly do lead to death as well.
And a real concern that HIV and TB, especially if we don't get those correct numbers, that those who are suffering from this are not getting the medication. I know you touched on it, but I mean, this could be a massively growing problem, couldn't it?
Yeah, so very interestingly, the WHO has come up with another index of quality of health. And even though our life expectancy in South Africa has certainly increased, our quality of life has certainly not been affected markedly over that 20-year period. So yes, we're already seeing deaths in younger age groups, but we know that the focus of deaths certainly in the older age groups in Europe and other countries. But we should also be focusing on what's happening in our communities where we have high levels of TB and HIV as well.
Adrian Puren, good to talk to you. Thank you.